Welcome back to the deep dive. Today we're getting into something called hyperproteinemia in horses.
Sounds complicated, maybe.
Bit of a mouthful, yeah. But it's actually a really fascinating clue vets use. Think of it like a detective clue in figuring out a horse's health.
Exactly. It's not really a disease itself, more like a signal, a lab finding that tells us something else is going on.
Right. So our mission today is to really unpack that. What is hyperproteinemia? Why does it happen? How do vets track it down?
And crucially, what's it telling us about the horse's overall health? We've looked at quite a few sources to piece this together for you.
Okay, so let's set the scene. Hyperproteinemia, what are we actually talking about?
We're talking about finding an abnormally high level of total protein in the blood plasma. It pops up on a standard blood chemistry panel,
Just a number on a test result then, but an important one.
a very important one. It signals an imbalance somewhere.
Okay. And the protein part, what proteins are we actually measuring in the blood?
Good question. The main players are albumin and globulins.
Albumin. I think I've heard of that.
Yeah, it's the most abundant one, made mainly by the liver. Its huge job is maintaining oncotic pressure.
Oncotic pressure.
Basically, it acts like a sponge or a magnet, keeping fluid inside the blood vessels. Prevents it leaking out.
Ah, okay, so it stops things getting puffy? Sort of?
In severe cases, yes, lack of albumin can lead to edema or swelling. It also transports things like hormones and drugs, and it's a kind of protein reserve.
Quite the multitasker. And globulins.
Globulins are more diverse. Some come from the liver, but many are from the immune system.
Ah, the immunity angle.
Right. This includes immunoglobulins antibodies, which are crucial for fighting infections, and also things called acute phase proteins, which jump up during inflammation.
So hyperproteinemia just means the total protein is high. Could be albumin, could be globulins, could be both.
Precisely. The total number is above the normal range.
Got it. Okay, so how does a horse get this high protein? Our sources mentioned two main ways, right? Relative versus absolute.
That's the core distinction, yes.
And you mentioned earlier, relative is the one you see most often.
Oh, absolutely. By far the most common scenario.
So what happens in relative hyperproteinemia?
Well, the interesting thing is the actual amount of protein in the body hasn't changed. It's still the same.
So how is it high then?
It's because the liquid part of the blood, the plasma volume, has decreased. So the proteins that are already there become more concentrated.
Ah, like making strong juice by letting water evaporate. The flavor gets stronger, even though you didn't add more concentrate.
That's a perfect analogy. That's exactly what happens with dehydration, or what we call hemoconcentration.
Dehydration. Okay, that makes sense. So that's the usual suspect.
By far. The horse loses water from its bloodstream, and everything left behind, albumin, globulins, red blood cells, gets more concentrated.
And you'd see that concentration effect elsewhere on the blood test too.
Yes, usually you'll also see an increased packed cell volume, the PCV, or hematocrit. That's a measure of red blood cell concentration.
So high total protein plus a high PCV, ding, 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 dehydration is top of the list.
That's usually the first thought, yes.
What signs might you see on the horse itself? What physical clues point to dehydration?
You'd look for things like sunken eyes, maybe. Skin tenting, you pinch the skin on the neck and it stays tented up for longer than a second or two.
Okay.
Also dry or tacky gums. And if you press on the gum, the color should return almost instantly. If it takes longer, that's increased capillary refill time, another sign.
Right. Clear physical clues. And what makes a horse get dehydrated? Is it just not drinking enough?
That can be part of it, sure. Maybe they're in pain and don't want to drink or just not thirsty. But more often it's about losing too much fluid.
Like how?
Think about severe diarrhea, like you might see with salmonellosis or Potomac horse fever. Huge fluid loss there.
Oh, definitely.
Or excessive sweating, maybe after really hard work or in very hot weather. Even extensive burns can cause significant fluid loss.
Okay, so that's relative hyperproteinemia concentration due to fluid loss. Now, what about the other path? Absolute hyperproteinemia. That sounds different.
It is different. Here, the body is actually making more protein. There's a genuine increase in the total mass of protein circulating.
And is it usually albumin or globulins that are increasing?
It's almost always an increase in globulins. We call that hyperglobulinemia. That's the most common type of absolute hyperproteinemia in horses.
So the body's making more globulins. Why would it do that? What kicks that off?
The number one reason is chronic inflammation or chronic infection.
Chronic. So something that's been going on for a while.
Exactly. The immune system is stimulated over a period, producing more immunoglobulins, those antibodies, and more acute phase globulins to deal with a persistent threat.
You mentioned acute phase proteins earlier. They jump up quickly with inflammation.
They do. Things like fibrinogen and especially serum amyloid A or SAA, they can rise really fast within hours or days of something starting, often before you see other clear signs.
Wow, like an early warning system.
A very sensitive one,
Yeah.
yes. They tell us inflammation is happening somewhere.
Can you give some examples of those chronic problems in horses? Where would you expect to see hyperglobulinemia?
Sure. Things like chronic abscesses, maybe internal ones, or like you see with Strangles carriers.
Mm-hmm.
Chronic lung issues like equine asthma, chronic laminitis,
Okay.
peritonitis, which is inflammation in the abdomen, even lung abscesses in foals, like from Rhodococcus equibacteria. These long-term battles trigger that globulin production.
What about the immune system itself going wrong?
Yes, immune-mediated diseases can do it too. Conditions where the immune system is overactive and mistakenly attacks the body, like autoimmune hemolytic anemia.
And cancer. Can that cause high globulins?
It can, yes. Certain cancers, especially those involving plasma cells, the cells that made antibodies, things like multiple myeloma or sometimes lymphoma.
How does that work?
These cancers can produce huge amounts of a single type of immunoglobulin. We call that a monoclonal gammopathy.
Monoclonal, like
Yeah.
one specific antibody.
Exactly. Think of one factory gone wild, churning out just one product. That's different from chronic inflammation, which usually causes a polyclonal increase, many different antibody factories ramping up production broadly.
Ah, okay. So monoclonal is more suspicious for cancer?
It can be, yes. Particularly in older horses, polyclonal usually points more towards general chronic inflammation or infection.
Interesting distinction. Any other causes?
Well, kind of a niche one, but horses used to produce anti-sera, like tetanus antitoxin, are deliberately hyperimmunized. They'll consistently have high globulins because their immune system is always being stimulated.
Right. So mostly globulins driving absolute hyperproteinemia. What about albumin? Does the liver ever just make too much albumin? Absolute hyperalbuminemia.
That's extremely rare. Honestly, almost never happens as an absolute increase. If albumin is high, it's almost always relative due to dehydration concentrating it. The liver has massive reserve capacity, so overproduction isn't really a thing.
Good to know. Okay, so we have these two paths. How does the vet act like that detective, using the blood work to figure out which path it is? What's the process?
It starts with that basic chemistry panel.
Yeah.
We get the total protein, or TP.
Right.
The lab measures the albumin level directly, and then the globulins are just calculated. Total protein minus albumin equals globulins. Simple subtraction.
Okay, seems straightforward. But you mentioned a ratio, the AG ratio.
Yes, the albumin to globulin ratio. This is absolutely key. It's often where the real insight lies.
Why is it so critical? What subtle clues does it give?
Because it helps us separate dehydration from those deeper issues. Think about it. If a horse is just dehydrated, both albumin and globulins get concentrated roughly equally.
Oh, they
Yep.
both go up together.
So the ratio between them stays relatively normal or maybe drops just a tiny bit. So high TP, normal-ish AG ratio, likely dehydration.
Gotcha.
But if the total protein is high because the globulins have massively increased due to chronic inflammation or something,
Then the globulin number is way up, but albumin might be normal or even low if the horse is sick.
exactly. So the AG ratio will be low, significantly low. High TP, low AG ratio, that immediately points us towards absolute hyperglobulinemia. That's the big aha moment. It tells us to look for inflammation, infection, or maybe even neoplasia.
So that ratio is like the crucial signpost. Don't just look at the total protein, look at how it's made up.
Precisely. It guides the whole investigation.
What other clues support the diagnosis? What else do you look at?
Well, as we said, that packed cell volume, the PCV, if it's high along with the high TP, that strongly supports dehydration.
Makes sense.
And then, of course, the physical exam is crucial. Assessing hydration status directly, listening to the lungs, checking for any signs of chronic illness, feeling for lumps or bumps.
Okay. And if things do point towards that absolute hyperglobulinemia, that low AG ratio suggests something deeper is going on, what are the next steps, the more advanced tests?
Then we'd likely run a complete blood count, a CBC, to look for signs of inflammation in the white blood cells. We'd also probably measure fibrinogen and especially SAA, those acute phase proteins. They give us a really good sensitive measure of active inflammation happening right now.
Better than just the globulins themselves.
They react faster often. The globulins take days to weeks to build up significantly. SAA can shoot up in hours, so it gives a more real-time picture of inflammation.
Got it. And if you suspect cancer, that monoclonal gammopathy thing.
Then we might recommend a test called protein electrophoresis.
Electrophoresis.
Yeah, it basically separates out all the different protein fractions in the blood. It can clearly show if there's one specific immunoglobulin spiking up really high, that monoclonal peak suggesting cancer, or if it's a broad, general increase in many globulins, the polyclonal pattern typical of inflammation.
Wow. Okay. So that really helps nail down the cause.
It can be very informative, yes. And from there, diagnosis might involve specific things like cultures if we suspect infection, maybe biopsies, or imaging like ultrasound or x-rays, depending on what we suspect.
So this all leads to treatment. But if hyperproteinemia is just a symptom, a clue, how do you treat it?
That's the key point. You don't treat the high protein number itself. You absolutely have to find and treat the underlying cause.
Right. Fix the root problem.
Exactly. There's no magic pill to just lower protein levels. They'll only return to normal when the underlying condition is resolved and the horse's body gets back into balance.
So for the common one, dehydration.
Fluid therapy. Simple as that usually. If they can drink, oral fluids might be enough.
Okay.
If it's more severe, intravenous fluids like lactated Ringer's solution are essential to rehydrate them, expand that plasma volume back to normal.
And dilute the proteins back down.
Precisely. And naturally, you also treat whatever caused the dehydration in the first place, like the diarrhea or the colic.
Okay. And for the absolute kind, the hyperglobulinemia caused by inflammation or infection.
Then treatment is all about targeting that underlying issue. If it's a bacterial infection, appropriate antibiotics. If it's inflammation, maybe anti-inflammatory drugs, though they don't fix the cause, they manage symptoms.
What about abscesses?
Surgical drainage might be needed for abscesses. For chronic diseases like asthma, it's about long-term management strategies.
And if it turns out to be cancer?
Then treatment depends entirely on the type of cancer, the stage, and the horse's situation. It might involve specific cancer therapies if appropriate.
It really hammers home that hyperproteinemia isn't the end of the story, it's the start of the investigation.
Absolutely. It's a fantastic diagnostic tool, a signal the body sends up.
A really powerful clue, telling the vet where to look next. It's amazing how one number on a blood test can point towards dehydration, chronic infection, immune disease, even cancer. Shows how interconnected everything is.
It really does. It makes you think, doesn't it?
Yeah.
You know, what other seemingly simple numbers, maybe in our own health checks or our animals, are holding these deeper stories?
A subtle sign that, if you know how to read it, tells you so much more. It's a reminder that sometimes the biggest clues are hidden in plain sight, just waiting to be understood.
Well said. It's about listening to what the body is trying to tell us, even in these quiet ways.